Welcome to the NeuroCog Podcast, a human-focused series framing autism and the process of differential diagnosis from a historic to modern-day perspective. I am Dr. Myah Gittelson, a clinical psychologist and founder of Gittelson Psychological Services in Los Angeles. I specialize in children and assessments for developmental skills and autism spectrum disorder across the life cycle. I'm passionate about helping families understand autistic neurology in a way that feels human, empowering, and practical. I do this work because every child and every family deserves clarity, support, and the tools to thrive. I'm joined today by two very special co-hosts, my dad, Dr. Jay Tarnow, founder of Tarnow Center for Self-Management in Houston, Texas, and my friend Neil Hughes, a savant with autism and founder of Enscape, assessment and training company based on narrative medicine.
Today's episode, My Journey to Assessment, Part 1.
There's been an evolution of the thinking about what autism is, and it keeps on changing. Not everyone is educated.
I don't know, in 1979 or in 1980s, we understood abuse, but we really got abuse down now.
My natural state is terror, confusion, and itchiness.
Sometimes assessors have that lens on that's the focus then.
I'm a very busybody, and I was spinning a lot. I'd tap my head against the wall when I was frustrated.
When you got to be 15, did you start having any friends?
What is the spectrum? You can't touch that.
The reaction people have to the truth when it's dealing with male-on-male violence. People were talking about me as if I was the problem.
You did better when you had a good tester. I was struck with when I first met you was, hold a second, he has autism, but he's so nice. He's so caring.
Today we are here discussing Neil's assessment journey. So Dad, you spent last night reading over Neil's assessments starting from 1979. How was that process?
Well, it was interesting to go through it because it reminded me of the evolution of psychiatry from 1979 related to autism to the present. And I thought it was just fascinating for me, having lived through that period with all the name changes and all the discussion about what is autism and what is it not, and how do you define it and be able to help people. So Neil, when I went through all this, it was fascinating that you kept on being diagnosed with different things, right? Every person was looking at a different part of this elephant in terms of your different pieces of you, and not realizing that all of this was integrated into a person. So I was continually reading about a medical patient, and knowing you makes it very, very different. So I must tell you that when I went through it, I was continually saying to me, but this is not really the person that I've met. This is not the person that I've interacted with. Who are they talking about? So that was my initial impression.
Right.
Neil, what I wanted to ask you, let's go back, and I'd like to find out about how it all began. When you started early on, and what was going on that you remember about growing up in your family and then entering school. Let's start with your family.
Sure. So I have I have clear memories of being assessed in 1979 as a 9-year-old. So I was born in 70, and I lived in the same house until I left for college. So it was a very stable home. But there was something not right in the home, and I have words for it now, but as a kid, I'd remember my dad would slam the door at people knocking on the front door. It was like the people weren't coming into our home. And there were 6 of us. And later on, I found out that I was assessed with my brother David, but those assessment records weren't kept about my brother David. So I have clear memories of being in an overwhelming environment and being distracted and not getting along with teachers. I know that my older brothers went all the way through private school, but I was taken out of private school during that assessment time because I was a handful or too smart for my own good.
Why was that? Why were you taken out of the school and transferred to a different school?
I don't know what the actual, I just think that, I don't know if they asked me to leave or if my parents said it was, I can't speak for them. So as a 9-year-old, I think I left the private school later than the assessment. I think the assessment was part of figuring out what to do with me. And then eventually they said, we're just going to put the last 3 into public school. So it might have been economics. They could have just been like, it's not working and maybe we should try public school. And what I know about public school is that I would wet myself in my chair. That's how terrified I was in public school. And I know that I was bullied by the teacher in 4th grade. And then I would wet myself, and I did it repeatedly. So I don't remember wetting myself in private school, but I do remember shitting my pants regularly when outside of the home doing like Boy Scouts or other things. I would lose control of my bowels. So I was having some clear distress happening, but I think that has less to do with autism, and it's more to do with that other history of sexual violence.
Okay. You bring that up, and it seems that that's been a prominent thing for you, is about the sexual violence that you went through and experienced.
Well, what reinforced that is that every time people would ask me for my medical history, they would fixate on that. So it's kind of a conditioned response that's, oh, I'm going to be in therapy. They're going to want to hear about all the violence. And then I'm going to have to talk about it over and over again.
Well, that's what's really interesting for me as an assessor when I have assessments with kids that are in the foster care program. They often have had a history of abuse. And sometimes assessors have that lens on that's the focus then.
Yes.
And so the distraction, it's a distraction of finding the diagnosis or assessing for the diagnosis because everything is a product of the trauma.
Yes.
And then the child gets diagnosed with PTSD and the autism is just left alone.
Correct.
One of the things that I'm really interested in is about your early childhood, because it's fascinating to me that the first evaluation when you were 9 didn't really talk about your childhood, your early childhood, and it focused on having a stable family. And it sort of painted a picture that everything was fine, there was no problem except you.
That was curated, yes. I'm sure that was what the intake looked like with my mother.
Yeah, and so it was focused on you and how of what your differences were in terms of school.
Right.
Not necessarily personality-wise or anything like that, but around the educational piece.
Right.
So can you give me a better idea about that early childhood? I mean, you were living with a whole bunch of people.
Yeah. And it wasn't, it was not rosy. And I was moved out of private school into public school in 4th grade. And the memories I do have are pretty distinct, and it's with angry people, disappointed people, people shaming me for my behaviors. Some of it was obviously, when I went to public school, I was peeing myself in my chair, putting my head down and not knowing what to do next. And the public school kids were bullying me in ways that I'd never experienced in private school. So that was that year. And Myah, you might know what age people are at 4th grade, but I don't think 9-year-olds are 4th grade, are they? Oh, really? So I got tested, then moved to. So yeah, that's part of my thing is I don't have a clear timeline of my life. I just have these records, and then I have, for very different reasons, I'm getting tested throughout my life. So I'm 55 years old right now, and you're asking me about the 70s, and I remember the polyester pants that I didn't like. They're very scratchy. I remember not knowing what to do about getting to the bathroom without being bullied, so I just sit and pee myself, and then I get bullied more. In scouting trips, I was incontinent because of not being able to speak up or being what we call nonverbal. I think that my parents are very protected at that time because of some other things that were happening in Utah. So it was a Mormon family in Virginia, but there was this chaos happening in 1967, 68. I was born in 70. So if I take a trauma lens and all the things I've read throughout my adult life, I'm like, yeah, it makes sense. My parents didn't have resources for me. And then when they show up to the neurocognitive center or the neuropsych testing, in the report it says that I'm very compliant. And I'm like, that's not my experience. I was just beat down is what it felt like.
Mm-hmm. Yeah. You were just following the rules because you were afraid
Yeah.
more than anything else.
And what's funny is I went into that testing center with young women that were bright and happy, and I didn't know how to interact with them. That's been my experience with you two, that you're bright and happy and open-hearted. As a 9-year-old, I wouldn't have known how to act with you guys because that wasn't my day in and day out affect or regulatory environment.
Mm-hmm. Mm-hmm.
So that's
So your relationship with your mom, what kind of relationship did you two have? How did she deal with a person?
I was in
who
my room
different?
a lot. I was in my room, and I would call it decompensation from the psychiatric world. I was decompensated a lot in my childhood. And it was a very disjointed, I'm having it right now. It's the dissonance. It's the constant, am I doing it right? Am I doing it right? And it's a moving goalpost. We're gonna do this, and then it's me working for hours on things by myself. I don't know. I'm very busy. I'm a very busy body. I can't stop moving. And I was spinning a lot. I would spin. I'd tap my head against the wall when I was frustrated. Once I found skateboarding, that was 1976. That was my thing. I would just skateboard all the time.
Oh. Who did you skateboard with?
Myself.
By yourself?
Yeah.
Uh-huh. What kind of relationship did you have with your brothers? Because you had, 4 brothers?
Yes. So I'm the younger brother of Eric Hughes. He's famous for his cryptography. Brian and David are dentists. And then the last 3 is me and Amy and Jason. So my relationship with Eric was also kind of not as bullied as Brian. Brian was the one that my claustrophobia, I think, is more to do with my brother Brian than the sexual violence that I experienced by the neighbor.
And so did your brothers accept you as part of the team?
No, I feel like there's 2 sets of kids. There's the before 68 and then there's the after 70. And that's why the drama in Utah makes sense to me, because before that happened, my parents were working together and they were newly married and they had this home, and the dental practice was attached to the home, and it was very idyllic. And then it turned into a nightmare for my mother. And I think my dad, now that I know what happened, when my grandparents would come, it was I'm very sensitive to what's happening with people. And it was just more of that chaos. When the grandparents would come, my dad would leave the room. He wouldn't face off with the grandpa. He had nothing to say to him. It's like something had offended my dad, and I never understood what that was.
What was your relationship with your dad like?
He's very quiet and very academic. So he had been a pharmacist, and then he became a dentist. So he had served 3 years in a mission for the church. Then he was an infantry person in the Philippines, and he has 2 military records, so we're pretty sure that he saw a lot of action.
And did he accept you as a loving father?
Yeah, in the Jungian, he's my anima. He's the nurturing. But I didn't have access to him because of that orthodoxy of what men do and what women do. My dad never changed diapers. He was born in 1921, and he didn't finish his dental training until late 60s, and married my mother then. So 64, 65. So he was 21 years older than my mother. Often they thought it was a dad and daughter situation while I was growing up. So there was that also. There's a huge generational gap between my dad and me. And skateboarding was something he did not understand at all.
No, not at all.
And skateboarding was a crime. It was absolutely a crime growing up. I was in custody of cops all the time. They were taking my stuff, they were harassing me. There was no place to do it. So there was this constant antagonizing feeling growing up.
Where was your safe place?
On the skateboard.
On the skateboard? See, back then we didn't have skateboard parks.
No.
We didn't, that's why the whole thing of getting in trouble, right? Because back then, the skateboard was, the most fun thing to do on a skateboard was go downstairs. Or jump off high places.
Right. Loading docks. People don't like you on their loading docks.
Yeah. And so that's when you'd get in trouble, when you were by yourself in loading docks and places like that.
Right, but I'm very busy with my body, so if I wasn't skateboarding, I was building obstacles or ramps in the backyard. So I had a skateboard ramp by his dental office, and he'd have a patient, and I'd just keep skating. There was a lot of anger towards my dad at that point. This is after the cops got involved with the sex abuse. So I kind of lost my dad when it's funny how the reaction people have to the truth when it's dealing with male on male violence. So the sexual violence that I had was never believed. I was always lying or not. I was not the sane child in the house. I made stuff up is what people said. And that narrative came from the abuser. So my abuser was feeding my parents an entire narrative about how crazy I was, so that when I actually did tell the truth, no one would believe me, including the cops. So it's a crazy-making environment, or an invalidating environment, if you use Marsha Lanahan's framework.
Well, you have this process of who can you trust, right? And the fact that you didn't have a lot of people around who you can trust and tell your story, who are going to be supportive.
Well, I had surrogate parents. I had people that they weren't allowed in the house, but they knew that I needed help. So I had in and out of people going, oh my gosh, I can't believe you're dealing with that. Let's do something for you.
Yeah.
So really the trauma was out in the open when I was 15, and I wasn't believed, and I was constantly being questioned by neighbors. Did that really happen? Like, people were talking about me as if I was the problem.
Right.
In 1985. And that report was what my mom used to justify her not believing me. And the report says nothing about it has nothing to do with my sanity.
No, had nothing to do with it.
But she literally held onto that report as a way to say, I didn't cause the problem. I'm not party to this. It's just how he is. That was through the 80s, because the man was convicted in 92. So by 92, it was all resolved, but by then I'm out of the house, I'm living in Utah.
Did you feel vindicated when he was convicted?
No, they didn't include my testimony. The DA had a faulty conviction. The grand jury was never given my testimony, and the way that it was framed was that if I was going to get any justice, I'd have to attach my name to this prosecution. And what I testified of was torture and rape and violence, and what the 4 women are talking about is nothing to do with that kind of stuff. He had a different sexual relationship with me. And he preferred women. He preferred women, and then he preferred girls, and then he was disgusted with me. So I was getting a very different narrative from the abuser. He would tell my parents something, but he would be whispering in my ear, you're disgusting, I can't believe you're doing this, and if you tell anyone, I'll slit your throat. So the internal narrative that I have in my head is one of an abuser telling me what I am, and then getting my parents to believe that other story about being insane. So I really didn't know what reality was for a long time.
Yeah, it must have been really confusing in terms of growing up.
Yeah, I don't have anxiety, I have confusion. My natural state is terror confusion, and itchiness. And I can tolerate any kind of pain. Pain is not an issue, which is why I like skateboarding.
But when you look through each of these evaluations, what happens is that people are continually focusing on your cognitive capabilities, right? And about how intelligent you are, and you should be achieving more,
What a
more.
bright future if I just work harder and have a quiet place to be. My quiet place was not in the home, it was in the arms of an abuser. My quiet moments of life were a hug machine like Temple Grandin developed. That's how he groomed me. He would calm my nervous system down with direct pressure, and then he would do his tortures and other things. So it's a very confusing world for me to have the only place I can regulate is with someone that's violent. And then my older brothers reproduce that same thing, and I just think, okay, that's how I guess as a child I just thought, well, everyone's getting treated by this guy, he's a family friend, and my brothers act like him, so aggressive people are what I have to deal with in life. And I'm a non-conflict person, but if you ask me a question, I don't filter what the truth is. And then I've been told my whole life, well, that's not, you're having a problem with your perceptions.
Mm-hmm.
So you're basically a schizophrenic or a psychotic person.
Mm-hmm. So it's always the process of you questioning yourself, and what's the reality, and no one believes me, and how.
I actually don't, throughout this is why people are perplexed by my cases. I've never felt suicidal. I think if I had doubts, then yes, I wouldn't be here. Mm-hmm. But this whole time I'm thinking faster and better and problem solving everything else in my life. I cannot solve this problem. That's how it felt. I can solve anything, fix any car. I can practice skateboarding until I get it, which takes hundreds of tries. I cannot fix my parents' love for me. Mm-hmm. It is tied to my shameful behavior.
Who became your first friend?
You have hard questions.
Yeah.
I don't know how I would respond as a 9-year-old who my friends were. Mm-hmm. But my roommate was David, my older brother.
Yes.
And he has looked out for me.
He did? So he became your protector, the person who cared for you? Mm-hmm. And you felt that connection? Yeah. Yeah. Well, he was the gift for you. He was the person there.
But in a way, he wasn't there because his response to the craziness was very different. We were like the odd couple. I was a mess, and he needed everything clean. So it wasn't a perfect relationship. It's just the best I had. But you're talking about friend. Mm-hmm. You're talking about being able to make friends. Mm-hmm. And I don't know that I was able to even have the pro-social behavior to know what that is. I could see other people in friend groups, and I could see other people having sleepovers and talking about what they did on the weekend, and I was cloistered. Mm-hmm. I was an embarrassment.
Mm-hmm. Mm-hmm. And when you got to be 15, did you start having any friends when you got older?
Well, yeah, I think that I have friends now, people in this room that I'm closer with than I ever could as a child. When you have so much load, then there's so much load on your nervous system, and you're burned out all the time. It's hard to really have, either you're over empathizing or you're not able to connect with people. So I had unhealthy relationships where I'm not fetal alcohol, but I think I had a lot of fetal alcohol behavior, where I just do what people said. Oh, let's go do this. Let's go get in trouble. Let's throw eggs at stuff. Mm-hmm. And I'm like, okay, yeah, let's do that. It wasn't what I wanted. I don't think you could have told me, what's your favorite food? I'd be like, I have no idea. It's whatever you want. That's how I was raised. It wasn't my needs being met, it was my parents. Mm-hmm. And those needs were never clear to me. And then it was the neighbor's needs, and then it was my roommate brother's needs. I was always serving people or enabling, or however you want to describe that. I mean, we have languages for all those things, but I'm a survivor of terrible behavior, whatever lens we want to use for that. But it didn't make me an equal partner in life. It made me subservient or subdued. My nervous system, the way I think of it is, I wasn't in the hierarchy. I was the guy, like the house elf in Harry Potter. So don't give me a dirty sock because I'm going to take off. And I was taking off all the time. I was breaking rules all the time. I was a runner. I didn't like running. I would skate, but I'd go and skate all night. Cops would pull me off. I don't know if you've been to Virginia, but there's a lot of, in the Fairfax County, there's a lot of hills going 60, 65 miles an hour with traffic. And the cop would turn on the lights and I'd just pull over to the curb. Like I was a vehicle, like I'm with traffic, I just don't have a car. Like that's how my imagination works. Oh, I'm following the rules. You're gonna come up and give me a ticket and then I'm gonna keep skating.
Right.
So is that sanity? No, there's nothing, but is it logical? Yeah, it's logical to me. And I don't sleep normally, the way that people sleep.
So it's hard to sleep for you because of being so afraid and anxious?
Well, it's fractured sleep. I hate waking up early because then I have to go back to sleep to not feel sleep deprived, but I have nightmares and nightmares and nightmares. So I have cyclical nightmares throughout the night. And that happened this morning. But I'm also in front of cameras, so I understand why I might be having some anxiety. But I don't experience anxiety, I just have nightmares and I feel itchy and my head's clogged. I sneeze when people mention people that I'm feeling unsafe with, I'll sneeze. So I'm literally itchy to things that are emotional. So I don't know what you even call that, but you're the first psychiatrist that's even asking me these kinds of questions. I've never in my medical career had anyone curious about these things.
Oh, okay. Well, it seems that when I look at the testing, it's so variable. And what I noticed, so the first reaction was, oh, this is the history of psychiatry going through your life, reading all these things, because in each evaluation was a different perspective that people had, and were focused on different pieces of you. And the variability of the testing was amazing because so much of it, my sense, was you did better when you had a good tester.
Yes.
When you felt connected to that tester, your scores went up. I could see it on there, and I was trying to figure out, well, why are the scores here higher than what they were before? Yeah. And it doesn't make sense. It doesn't integrate for me, other than realizing that you're very sensitive to the tester. Yeah. The feeling of always being tested, and people trying to figure out, okay, what's wrong with this guy? Why is this guy here? What do I need to figure out?
Right.
And you don't know whether to be yourself or to please them.
Well, that's why I brought it up, yeah.
Well, yeah. I think that raises a good point in bringing it back to today, in terms of modern, assessments. And what I try to do is not focus on some of the right now here presenting when I'm seeing an older individual. Because if I'm trying to figure out what's at the core, it's the early childhood, it's those friendships you remember, it's the spinning, it's the, obsessiveness, it's all of those things that get me to the diagnostic impression versus the trauma. I mean, I know the trauma intertwines with all of those things, but if you're asking, does this individual present within the autism spectrum, I have to know all the other things, the early childhood, the friendships, those behaviors, more so than the noise of other stuff that interfered.
Can you talk about noise? I like what that means.
Yeah, so the noise of, the trauma is the noise. And the noise is actually not visual, but heard. So that's something we can touch a little bit better. right? So, we can touch that this actually occurred to this human. They had this abuse, and we can touch that. What we talked about in other previous episodes is what is the spectrum. You can't touch that. So it makes people uncomfortable to talk about assessing someone for autism when what is autism spectrum? Versus we know what abuse, now, I don't know in 1979 or in 1980s, we understood abuse, but we really got abuse down now.
Well, they had it down back then, but they didn't know what to do with it.
Okay. And that, I don't know, Dad, you could probably step in with this because, I wasn't alive back then. Well, I guess I was born in 1977. But in terms of abuse, again, is that tangible piece where
Right.
it hasn't changed forms. Abuse equals or defined as abuse is that. Whereas autism has changed forms from 1979 to 2025.
Right, exactly. There's been an evolution of the thinking about what autism is.
Right.
And it keeps on changing, and not everyone is educated. So I can tell you, as an adult psychiatrist, I got very, very little about autism. Nothing. Zero. When I became a child psychiatrist and started studying, then I started learning about it and realizing, I have to think about it. But, being traumatized is so sexy, right? And I hate for the pun there, but it is. For psychiatrists, oh my gosh, this is really sexy. Well, this is really something we can focus on and maintain and get into that, because we also know about it, but about the other pieces, about your personality and who you are and this issue about autism, no, we don't understand that at all.
And when you said it's sexy, and we can talk about why it would trump everything else. The fact that I'd literally have people in state hospitals saying, okay, tell me, they'd do an intake, and then they'd turn to me and say, I don't want this to sound like a compliment, because it's not, but this is the worst history this is the worst level case of not just what happened to you sexually, but what happened to you with the police, with your parents, with this narrative of you being the problem. That is a victim blaming culture that we're already in. But to be told that I have the best example of that in life, oh my gosh, right. You really got beat down and you're still here. Wow, here's your button. I'm like, I don't need a button. I need my meds. I'd be in these conversations with people because they told me that I needed the meds. And so for years I was being diagnosed and medicated. Because of the sexual trauma. Was like, this is what people like you are gonna be. It's not that I had a car accident or a tour of duty for the military, it's that I had this thing called really complex trauma. And I'm like, well, what you're actually saying is that I have a personality disorder.
Well, I didn't understand that actually when I was reading the chart and they mentioned that. I had no idea what they were talking about your personality disorder.
The IDC-10 is the International Diagnostic Manual, and it has a category called complex PTSD with its own symptomology. In America, when you talk about, this is for anyone listening, if you ever talk to your medical provider and you talk about sex abuse as a child and how it affected your development, then it's complex PTSD in Europe, but in America, it's PTSD with, and then they have to give a personality disorder. So narcissistic or borderline or Machiavelli, whatever, the dark triad. And mine was NOS. And this is University of Virginia, 2022. And my formal diagnosis was 2023. When I turned it in, they said, oh, people like you don't respond to medication. Because I had a formal diagnosis. I didn't understand that either.
Because of the diagnosis of personality disorder?
No, because of the diagnosis of autism spectrum disorder, we know that it's not a diagnosis that we turn to medicine for.
Right.
But
well,
go
there's
on.
no cure, but we don't have a specific treatment for autism, of even helping the symptomatology of that. And that's the difficulty from, a psychiatric point of view, is in psychiatry, unfortunately, what we do is we do clinical trials of medicines. So basically, we throw a medicine at somebody based on our judgment about what the literature says might help that diagnosis. And that's why we make diagnoses. But when you have this diagnosis that's vague, unclear, personality disorder, NOS, you don't know what to do really. And unfortunately, we didn't have a way to be able to measure the brain. That's the big difference that the quantitative EEGs have done for all of us, is given us a way to be able to measure what's going on in the brain.
Right.
The closest stuff we had, Myah, is doing neuropsychological testing, that would give us some way of looking at the brain, but it's very obtuse and very removed from the real person.
It really is. And I think, it leaves too much, though, of the evaluator's emotional side of interpretation. Mm-hmm. I mean, just like, drug companies coming and telling you this is going to help this diagnosis and these things, and then you're just following that. The same with, I guess, a neuropsych, is that the evaluator follows some type of research of what other people are saying, and then they interpret the findings. Yes, I think the QEEG gives us more of that data that's not interpreted necessarily, and you can then, if you want to medicate, you are hoping that the medicines, target those one areas. But we haven't even talked about that medication's a blanket. And if you're slowing something down, you're going to speed something else up, or you're going to, if you want to speed something else up, you're slowing that's tricky as well.
Yeah. How did you feel, Neil, by people giving you medicines and throwing medicines at you? How was it as being a patient? Because what I'm hearing is you've walked through life is everybody's seeing you as, oh, he's a traumatic patient. He has trauma, but he's a patient, and not really seeing the complexity of you. So when people are giving you medicines, did it help?
Well, what is the word help? I mean, what aid was I asking for? Like, I didn't really ask.
True.
I didn't ask for these environments to be so antagonizing, to where I was always having emotional overwhelm, leading to rage and burnout. Like, those are neurological terms. We can call it anxiety and depression, but it's really about my nervous system being overstimulated. This is from the autistic lens. And then having emotional overwhelm leading to rage, and it's usually internal rage from those voices from my childhood. And then burnout, where I just don't function and I drop out. I went to college, 3 different universities, because I couldn't get past the second year. And so until I had 3 kids and my wife was dying of stiff person syndrome in 2005 or 6, I'd already been inpatient. I'd already been diagnosed psychotic, bipolar. Like, I'd already had all these labels and all these meds. By the time I was out of all of my surgeries for the spinal cord injuries, all of the inpatient and outpatient, my son was sitting on my chest. He was born in 2003, so I think it was 2004. A friend from the Veterans Administration called. So I was pre-med at University of Utah, and he had gone through medical school, and I kept flaming out. And so we were still friends, and he said, Neil, and I couldn't really respond because of the medication. And he said, you know what? If you were a veteran, we would have you golfing again. What do you love doing? I said, I love skateboarding. So then that's what we would do, because a surgeon's going to protect hardware. But we protect soldiers. We protect their lives. And their goal is to get you back to being yourself, whether or not you have titanium in your spine. So my lower back has been rebuilt, and he's telling me to go skateboarding again. So what is medication to me? It's being active. It's having clean food. It's getting what sleep I can get. Abilify, Zyprexa, that's 300 pounds me. I feel harmed. I feel sad. I feel a sense of grief when I think about the medicated me. on a couch, 300 pounds, with a son that I cannot care for. And it was a medical professional in the Veterans Administration saying, oh, I see this all the time. We're not making this about you, we're making it about hardware. The VA focuses on the person. I needed a doctor to focus on me as a person.
And you found that?
I did. I found that, and then he modeled for me where else to look for it. And so now I have a whole team of doctors that I respect, and they respect me. Mm-hmm. So who's my first friend?
Mm-hmm.
You're my first friend in psychiatry.
Mm.
Rick Perry's my first friend, and he's a physiatrist, so he does physical medicine and rehab. Mm-hmm. And since I met him, now I'm friends with 4 other PM&R doctors. Mm-hmm. And I go to the running clinic now. Mm-hmm. I'm not just wearing a leg brace, I'm not just in a wheelchair, I've worked my way out of those things, and now I wear toe shoes. And I can't run, but I can get my feet videotaped, and that's medicine. Mm-hmm. When I hear the word medicine, I see myself working my body to exhaustion so that my legs will work again. And the more I focused on my neurological needs, then I stopped having these emotional overwhelms or psychotic breaks or whatever you want to call it. And then the doctor's saying, people like you don't respond to medication. I'm like, well, for me, medication is food, sleep, and exercise. So I actually do respond to medication. I just don't respond to pharmacological blankets, as Myah so aptly put. And as an autistic person, that's a great way to mask. When the world doesn't work with you, you just take your Zyprexa. And then when it doesn't work, you add Abilify. And when your lithium levels are too high, you titrate down. But to get off those 12 to 14 medications, that took 3 years. And I did it with a public health clinic. So Robert Barth is a friend of mine, and he ran the clinic there. If I didn't have friends, I wouldn't be here today.
Mm-hmm. Yeah. So you created a friend group related to a lot of people who were caring for you.
I found that I could convert what was antagonizing into something that was supportive by focusing on their needs. Mm-hmm. And I don't even know how to explain that. There was a shift that happened when I had kids where I had to focus on their needs. And I'm not calling doctors babies, but there is a way to talk to doctors.
Mm-hmm.
Well, what's so interesting is going back to that question, who was your first friend? It's like, what's the definition of a friend? Just like you said, what's the definition of medication? What's the definition of a friend? You know, I'm definitely talking to parents about that a lot, because I think their definition of their kids having a friend is very different than maybe their child's connection or what's connection for them.
My first friend I would have wanted would have been my mom. Mm-hmm. So my definition of friendship is someone that you are completely intimate with, that never hurt you, they'd never betray you, they'd never shame you. That's a friend. And that's coming from Bruce Perry's work. And I love the book, The Boy Who Was Raised Like a Dog. He studied people like me. Mm-hmm. And he made sense to me. And the first time I heard Temple Grandin, I couldn't drive, I had to pull over. I'm like, you did what with a hug machine? That it shocked me that that's what I was doing with my nervous system with a pedophile. I didn't have words for that. I literally had a complete meltdown hearing her talk about her hug machine. And I'm not prodigious. I'm just a savant. I'm not a prodigious savant. I'm just that level of intelligence where I'm thinking faster and doing more with my brain than most people. And that's not supported, that you don't need people running that fast. But
it's hard to keep up. It's hard to keep up with you when you're running that fast.
Yeah, so that's what I think happened is I learned to slow down and meet other people where they are. And stop running.
Well, you know what I was struck with when I first met you was, hold a second, he has autism, but he's so nice. He's so caring, and his ability to be so caring and concerned about people, and was striking about you. And in my growing up in psychiatry, that's not supposed to be a characteristic of people with autism. And yet you have that. And that's what I was surprised. I was like fascinated. How did he get that? What did he do?
Well, that just speaks to, again, that the training that we've received is inaccurate.
Mm-hmm. Yeah. Right. I mean, that's what I've learned in doing this for 45 years and watching my patients grow up and seeing them change and develop. And the fact that they have that capacity,
Right.
if they have the right person around them. And that's obviously what
Right.
is your expertise, Neil, is you were able to identify what you needed after a while and to find people who could give you that.
Mm-hmm.
And the way you pull them in is by caring about them. But, just like you were talking about doctors, how to talk to doctors, because doctors always feel sort of alienated, right? And attacked, and that we have to defend ourselves. And, yet for you, you're very disarming that way, and talk about things in a way to talk to a doctor where they feel supported,
Yes.
that you're not going to attack them. Mm-hmm.
Yeah,
And that makes a big difference.
And there's this reaction I get with doctors where they don't like that about me. You're speaking to me as a person on my level, and then they don't want to talk to me. And that makes it easy for me not to do a return visit.
Right.
And a lot of my doctors are in a network of, I went to PT for my spine, and I asked just a clinic doctor, no one I would ever see again. I'm like, who's the best physical therapist? Mm-hmm. So they sent me in the University of Virginia, they sent me to the best UVA clinic, and I called in, I said, I need to see this guy. I got a referral to see the best guy. I didn't say that to them. When I went in to do PT, they didn't give me the PT I needed, but they're in the system, and I asked him, who's the doctor's doctor? Mm-hmm. Who do you see? Mm-hmm. And he said, Mark Lepsch. And then Mark Lepsch was a closed practice because the doctors go to him. Mm-hmm. So then I said, okay, I'll wait. And they said, you can't wait. I'm like, there's no waiting list. Well, there is a waiting list. Then put me on it. So I have to know all the parts of the system. This is my brain working here, right? I think through the whole org chart and how to. Anyway, I do that with everything. I do it with Social Security. I know how to use the keypad on the Social Security website to get to a real person within a few minutes. And most Americans wait hours on hold. Mm-hmm. I won't say it out loud because I'm sure they don't want, but there's always a hack. There's always a level of privilege in the system, and if you know the right code word, you get that privilege. So being pre-med, I'm the grandson of a hospital owner in Utah. Like, I have a medical background without having the medical training. That's an unfair advantage for me as a patient. And I've also done years of hospice. So the whole time I'm dealing with my own case, my wife's dying of sick-person syndrome in 2014. My dad dies of late onset hydrocephalus in 2009. And then Willa's dad died of the same thing later on. And her mom died of ovarian cancer. So I've been disabled with what you've seen. That's the whole timeline of me getting through Voc Rehab and all these other things. And I'm doing full-time hospice care. So I have medical training. But it's not the kind of medical training that you would want to wish on your worst enemy.
Mm-hmm. Yeah. Mm-hmm. But you keep on finding those people.
I have to. I can't survive this world without friends.
Mm-hmm.
Community is everything.
Community is everything. That's what.
Because we're social beings. There is no self-regulation. I cannot regulate anything. Just like you say, I only have attention when I'm in front of somebody. Mm-hmm. I am highly distracted because I'm isolated. And then I get into community and I have purpose.
Mm-hmm. You don't seem to have any problem making eye contact with people.
No.
That's one of the things, we're taught in medical school about people who have autism, is they have difficulty making eye contact. But for you, it doesn't seem to be a problem. You don't get anxious with it.
I have long stretches of time where I don't make eye contact.
I see.
It's about mental resources,
Mm-hmm.
and it's not about autism.
Mm-hmm.
It's literally a human response to not having the mental resources to engage because of some environmental stressor. Same with rocking and spinning. Just look at Guantanamo Bay or Abu Ghraib or what's going on in Gaza or whatever's happening in Ukraine. Find a population of stressed people and you'll see flapping and spinning and no eye contact.
Mm-hmm. Yeah, well, that's what's so complicated, right? Is because are you a person with PTSD or are you a person with autism?
Why not have PTSD from having autism?
Well, it certainly is possible.
Yeah.
Absolutely. Especially the way people treat you.
So
as you point out.
I have PTSD from car accidents. I have PTSD from sex abuse. I have PTSD from public school and private school transitions, from bullying.
Mm-hmm.
But what about just calling it an injury that I can heal from? Why not call it PTSI? Why are we disordered when we're naturally complex beings that are going to self-organize around community? Given the right environments, anybody will have a different response because we're social animals. We're designed for community.
Mm-hmm.
Right. So, I mean, what you're saying basically is individuals, humans, that were looking at this diagnosis in this lens, we have it wrong. Or the lens, I mean, the lens...
Well, you have it right if you're looking for disorders. You have it wrong if you're looking for restorative health. The word's restorative.
Okay.
Do you want people to go to their natural state? Then you have to support them.
Right.
If you want to keep them in a disordered space so they can get an IEP, then don't connect with the patient and just make sure they bang their head a few times. And then they can get the resources from the school district.
Yeah, but if they have trauma, then we're saying that it's because of the trauma.
That's my problem. That's my history.
I mean, I think that's happens a lot. It's unfortunately repeated a lot. That, again, with that tangible piece that we feel more comfortable saying that you have PTSD than autism.
Yeah.
And then again, if you were supported, and we all are humans, autism, bipolar, whatever diagnosis, we're all human at the basic level. And it's about supported, unsupported for your needs.
Mm-hmm. And the supports that I need are people like you guys to do assessments with the idea of the whole person. And that's through narration. That's the narrative. That's why I've never had a psychiatrist actually talk to me like Jay does. Because I go to public clinics.
Well, not even public clinics. I mean, I think, Dad, you're very unique because even, I have my child with a psychiatrist and the visit's 15 minutes with him. And I'm paying $450 for 15 minutes. So it's not even public clinics.
I'm sorry for your loss too.
It's privileged psychiatrists that are not filling the needs or supporting, because that has never been their role. It's not a fault to them. I don't want to say or criticize them. It's what they were told to do. And they're doing what they were told to do. They were trained and told, this is what you do as a psychiatrist. I think that Dad, and myself are people that are like, that's not right, or that doesn't feel right to me. We're gonna go against, and people don't like us for that sometimes because we're not following the rules of what, if you could just keep it simple.
Well, right, so the reason I was so excited to meet you guys, and I said immediately, you guys need to do a podcast, was because I recognized that in you. We were at a conference and you came up to my table and I'm like, I didn't even know you guys were related. I'm just like, who are these doctors that are coming to a neurotherapy conference? And then what was and I don't have words for it, but I thought if I had had you guys, my life would have been completely different. Because what you do, Jay, what you do in your very presence is you take me out of my trauma brain. I have a trauma state, and you've seen me go into it maybe 3 times today, and it's dysregulated, and it's emotional overwhelm, but I don't rage anymore. While I'm having the emotional overwhelm, I'm literally saying in my head, oh, this is my autistic overwhelm. I didn't have that language before I met Dr. Brand or Jen Glassell. These are my friends, and I'm adding more friends to my story so that when maybe this is an intervention that people could know about, but I literally say, oh, I'm having my autistic overwhelm. This isn't about trauma. This is about that quick emotional response. And what you would do for me as a 15-year-old, Jay, is regardless of your training, you would have asked for my narrative. Oliver Sacks trained you to tell your story so that the patient tells theirs.
Yes.
And you told me that within, was it the second time we met? I'm like, you were trained by Oliver Sacks? I've read everything by him. He is literally, okay, here's my first friends. Any book that was in my hand.
I see.
My friends were authors and a skateboard. And people were bizarre to me. They were violent and they were vile and they were not safe to me. And that you've been trained by the people that I've been connected to through their books. So that's why I'm so passionate about giving you guys platform. Wasn't because I wanted to be in your podcast. I wanted to watch your podcast, and I wanted other psychiatrists to watch this podcast and go, wait, I can just be open-hearted and then remove the fear and the trauma brain, and then we can actually deal with the day in and day out of this beautiful person. How do we make more of this happen? So if I went to a doctor and I felt better because of the doctor's appearance, that they show up for me and they listen, I would want more of that. Regardless of the medical treatment, I would want more time with that person. And that's Munchausen's, right? If you get that in the wrong way, then people start identifying as patient all the time, and then they just want to hang out with people that will prescribe and treat. So I'm not saying to go that far. I'm just saying in an assessment environment, and I don't have more than 1 or 2. I have, how many? 4 NeuroCog, and I have functional limitation, I have speech pathology. I forgot what I sent you, but I absolutely believe that what you're measuring is the human's connection to the testing agent. That is the first thing that's being tested, is the connection in the room. And if that person's having a bad day, the patient is not getting a good IQ score. If you want my IQ to go up, put me with Jackie at UVA with all the preparation that happened beforehand. We're not measuring my intelligence, we're measuring my ability to connect. And I have a high connective energy, and it is exhausting. So I wear a hat so I cannot see the sunlight. I need less stimulation, not more.
Right. Yeah, the connection is a key, and I guess that's definitely where I learned from Oliver Sacks in terms of understanding people not as patients but as a story. That each person has a story and who they are and what they're about, and being able to feel that was very special in terms of it. Feeling.
So my question to you is, when do I get to ask you a bunch of questions?
Yeah, no, we're going to do that. I think that's how.
That would definitely be the next episode. Stay tuned.
That's right. That's right.
Are we good?
You should be able to hear me.
Can you hear me? Do you hear me? Okay, perfect. Until next time, we're here for you.
This podcast, 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 this podcast was for entertainment and general information. It does not constitute medical advice or create a patient-doctor relationship. But what you can do is find qualified medical professionals to meet your diagnosis and treatment needs. And I would love for you to have a sense of purpose. And then you can go do your stuff.